Ah, oh boy, how far? I'm not happy at all. Oh. Imagine me going to the hospital and then later the doctor said that I need to be referred to a teaching hospital. Don't go. They are just indirectly telling you that you are going to die. That was how they referred my older sister, and she died while there. Do you know that these teaching hospitals are very expensive? They just want to steal your money indirectly. All these doctors of nowadays, me I'm not going anywhere. Make I dey go house. I go another hospital. Very good. Good for you. Wow. Just look at when I'm closing from work. I'm working in a general hospital and still seeing cases that could be handled in the primary health care centers. And these centers are closer to these patients than here. Since we don't know the difference, let me just be going home. Imagine, I haven't left my key. Oh God. Hello there. Hospitals are built based on the various levels of healthcare services they are intended to provide. So in today's video, we're going to learn about these levels of healthcare centers and the services they are intended to provide. We have the primary, secondary, and tertiary healthcare centers. However, there's one more, the quaternary healthcare center. If you knew this prior to this video, let me know in the comment section below. If you didn't before now, don't sweat it. This is not common knowledge. Let's start with primary healthcare centers. They are the smallest of all the facilities in terms of structure and manpower. They admit only for observations, handle labor and delivery cases, and also handle minor procedures. They are also responsible for health education to the community. Health workers in PHCs include doctors, nurses and midwives, community health officers, community health extension workers, junior community health extension workers, traditional birth attendants, and other volunteers. PHCs are usually the cheapest and sometimes free in terms of services provided. They are meant to be the first contact between a sick individual and the healthcare centers. There are more PHCs than other healthcare centers, and they refer complicated cases to the secondary healthcare centers. Now we move to secondary healthcare centers. They are bigger in terms of manpower and facilities. They provide specialist care but usually more generic or basic. Patients admitted are for proper management, not for observations. They perform surgeries, and they are also responsible for the training of primary healthcare workers. The doctors include more consultants and specialists. There you also find nurses and midwives, together with lab scientists, endocrinologists, and pharmacists also. Other staff include physiotherapists, dietitians, radiographers, and social workers, among others. Examples of secondary healthcare centers include general hospitals or cottage hospitals. Their services are usually more expensive than those of the PHCs, and this is because they handle more complicated cases and they refer cases beyond them to tertiary healthcare centers. Let's now talk about the tertiary healthcare centers. They provide highly specialized care and handle more complicated cases compared to the hospitals before them. Patients are usually kept for a more extended period of time. Tertiary centers have state-of-the-art facilities. Here you find more staff than in PHCs and secondary healthcare centers. Doctors here include more specialists and subspecialists. Health workers here are more highly trained, and they are also involved in medical training, especially of resident doctors and medical students. Tertiary healthcare centers are usually more expensive based on the services they provided. They perform all medical procedures possible. They are the final or highest healthcare services for most countries, and they refer to the quaternary healthcare centers if available. Examples of such include teaching hospitals, specialist hospitals, and specialized hospitals. Finally, let's discuss about the quaternary healthcare centers. These are an extension of the tertiary healthcare centers. They perform more advanced procedures than tertiary healthcare centers. Accessing their services is very limited and highly restricted. They usually engage in experimental procedures, as these are where breakthrough cases are being perfected, like the first successful separation of conjoined twins, or the open heart surgery. So before then, these surgeries were being seen as either too risky or outrightly impossible. They keep developing more breakthrough medical interventions. Quaternary healthcare centers get referral directly from tertiary healthcare centers. Patients usually have to wait for a long time before they can access their services, and 8 is the final stop in terms of medical intervention. So anything beyond them is beyond current medical knowledge. Examples include Cleveland Clinic and Children's Hospital of Philadelphia. So I hope you're able to learn something today and understand that simpler cases are supposed to be handled by the smaller hospitals, and the bigger hospitals usually have to be accessed via a referral. If this is your first time of coming across my videos and you enjoy them, please consider liking, sharing, and don't forget to also subscribe to my channel, where I make videos that concern everything about medical doctors and medical students. Thank you.